So Dr. Naveed Yusuf is Chair and Associate Professor of Practice, Department for Education Development at Faculty of Health Sciences, Aga Khan University. He is also an honorary advisor on psychometrics for the Royal College of General Practitioners International, South Asia Board, and a member of the International Association for Educational Assessment Recognition Committee. And this session on assessment psychometrics is by MedEdLeads.
Hello everyone, thank you so much for joining, and thank you to Dr. Andali Barshad and to MedEdLeads for giving us an opportunity to interact with each other and to engage with each other on assessment psychometrics. Indeed, a very essential, important topic which we as assessors, examiners, exam coordinators, developers, and faculty members face every day in our lives. Today, we aim that by the end of the session, we should be able to identify and interpret exam level and item level psychometric indicators. Item means question here. Apply psychometric analysis to examination scores to enhance validity, reliability, and fairness of decisions. Identify findings for feedback to stakeholders based on their psychometric analysis, and describe the commonly used standard setting methods. So what is psychometric analysis? Psychometric analysis is simply evaluating the information, that is data, from students' responses to assess the quality of tests, exams, items, which are questions, or scores. So we analyze this data, we evaluate this data and try and interpret to evaluate the quality of the exam, of the questions, and of the scoring. And why do we do that? In order to make sure that the assessment decisions or scores are valid, reliable, and fair. So why do we do psychometric analysis? There are two major reasons. First, we want to identify any flaws, any gaps, or any errors in the tests, items, or scores. And second, identify areas of good performance by students and identify areas needing improvements. So we identify flaws or strengths in the tests or items so that we can rectify post hoc after the examination has happened, before we announce the decisions or scores, to make sure that our decisions are valid, reliable, and fair, and also to identify good quality items for banking and revise those which need improvement or delete those which are very erroneous not to be banned at future use actually. And when we identify areas of good performance and areas needing improvement, we do it to give feedback to teachers, students, and other stakeholders regarding students' performance. So all what we will discuss today regarding psychometric analysis, first will be based on classical test theory. We know that there are two common theories we used: a classical test theory, which is time-tested, very old, decades old, and item response theory, which is relatively new as compared to classical test theory. However, at least today, it is a few decades old. So we will use classical test theory today, number one. And number two, this is a very basic level introductory session. So classical test theory states that all measurements have error associated with them. And when we discuss assessments today, examinations and tests, we are measuring. We are trying to measure students' competence, skills, knowledge, ability, attitudes, and give them some number or grades. And according to classical test theory, all measurements have error. So whatever we are doing, no matter how good or how bad, how poorly, it will have some or more error. And it is explained as the observed score, the score we get or we analyze, has two components: a true score, which is depictive of the student's true ability, competence, knowledge, skill, or attitude, whatever we are trying to assess, and some error. And the error can be a positive or a negative value. If it is a positive value, the observed score will be higher as compared to the student's true score, true ability. And if this error is a negative value, the observed score will be lower as compared to the true ability or competence of the student. Let me give you a very simple example, a very basic one. Suppose the examiner, the marker, the rater is very lenient, give more than required scores to students. So the error now is a positive value, and which will add to the true ability of the student, and the observed score we get or we give to the students will be higher than the true ability. And in comparison, if the rater examiner is a very stringent, a hawk will give very lower scores even below the true ability of the students. Here the error term is negative and the observed score will be lower as compared to the true score. And this is how very simply classical test theory attempts to explain it to us. And you must be wondering, if all measurements and all assessment scores will have error, why are we spending time on this session? Because as faculty members, examiners, assessment people, or leadership, our aim is to ensure that the error is as minimal as possible. So the error of measurement should be a relatively small fraction of the range of observation. Let me give you an example. Think of weighing scales we use to measure adults and weighing scales we use to measure newborn babies or infants. These are two different scales. Why do we use two different scales? Because we know that the sensitivity of the weighing scale for small babies, for infants and neonates, is very high. They are sensitive even to smaller variations in weights. So the error is low. If we use the weighing scale for adults, they are not so sensitive. So the error is high. The adults, the range of observation is in tens of kilograms, 20, 30, 70, 60, or in pounds. So the range of observation is high. So if there is a few milligrams of error, it does not matter. However, so the error is a relatively small fraction of the range of observation. For infants, for neonates, a few milligrams of error will lead to misdiagnosis, overweight or above weight, obese newborn babies. And that is why we use a different weighing scale where the error of that weighing scale is minimal, is a small fraction for range of observation. So what we will discuss today is as to how we can identify errors and try and minimize these during psychometric analysis. So please remember, there are steps and there are ways to minimize errors during item development, question development, during exam development, during the conduct of exam, before the conduct of exam, and after the conduct of exam where we analyze the scores. So today, we will only deal with some basic steps to analyze the scores post hoc, after the exam has happened. So what are the different scores of error? And I have tried to put the sources of error in this diagram. So the sources of error can be related to the item, the task, the question itself. The language of the question may not be clear to many or more students. If the question itself is misunderstood, it will lead to an error because the candidate, the student, will not be able to respond appropriately, even if he or she is capable enough to solve that question, but may not be able to during the exam because the task or the question was not clear to him or her. The examiner may lead to an error. As we discussed, a stringent examiner, a lenient examiner, an examiner which has not understood the task and does random errors, giving scores according to some other criteria and not the criteria which is the intended purpose of the exam, an untrained examiner, a novice examiner, and so on. The patient. So in many clinical examinations we also have the patients there. And if the patient has not demonstrated appropriately, has not responded to the student or candidate appropriately, or is behaving differently or responding differently with different students, giving out answers to one very easily, holding back information, important information to others for some reason or the other, may not like the gender, the grooming, the style, the culture, the background of the candidate, will introduce errors. Logistics and the environment. So for some exams, if you do not provide appropriate logistics or environment, too noisy, too loud, too cold, too hot environment may introduce errors, right? The examinee is not the source of error here. The examinee should be the source of variation. So what we want in a standardized examination, that all other factors we have talked about behaves the same for all examinees or candidates. The task should be understood similarly by all candidates. So the only variation in score is dependent upon the candidate's capability, ability, or competence, skills or knowledge. So if the score is going higher for some candidate, it should be because the candidate is more capable, is more competent, is not because the patient has favored and giving out information easily, or the examiner was lenient. And if the score for some candidate is going down, it has to be purely, mostly due to that the candidate was relatively less competent, less able, and should not be due to because the environment was not appropriate, the examiner was strict, or the patient was not cooperative, the task was not clearly written, and hence was not understood. So the variation in score, our aim as examiners, as exam coordinators, as examination leads, as faculty members is, the variation in score should only or largely be due to only examinee performance, capability, ability, or competence, and all other factors should be standardized. So we will talk of descriptive statistics, the mean score, the median score, standard deviation, minimum and maximum scores, number of failing and passing students, and we will also talk about reliability analysis. Most of you must have heard of Cronbach's alpha, very commonly used as a measure of reliability, item to total correlation, and standard error of measurement. This is very important. So every exam is made up of items, questions, steps. And these questions or steps may also be organized or classified into subtests, which may then become an exam. I will give you a couple of examples here. Let us think of an objective structured clinical examination, an OSCE exam. Most international OSCE exams may have 12, 14, 16, or 20 stations, OSCE stations. So each station becomes a subtest. This is the station. And all those 20 or 14 or 12 stations will become an OSCE exam. So the OSCE exam is composed of, for example, 16 stations. And on each station, there is a rating tool or a checklist or a list of steps which are there in the assessment tool or form, which is then marked by the examiners. And these are known as items. So items will make the station checklist, and all stations, which are the subtests, will make the OSCE exam. Now let us think of an integrated written one best MCQ exam. So at many institutions or at international level, there are licensure exams or final exit level exams, graduation exams, which consists a lot of subtests. So the main exam, which may consist of 201 best MCQs, for example, may have 4 subtests. For example, 50 questions on medicine, 50 questions on surgery, 50 questions, for example, on pediatrics, and 50 on other subspecialties. So these become the subtests. And each subtest will have 50 items, 51 best MCQs. So I gave you 2 examples as to how are we going to understand items, subtests, and exam. Items will make the subtests, subtests will make the exam. The scores on items will be totaled to make the scores on the subtests, such as OSCE station scores, and the scores on the subtests will be totaled to make the exam score. At many other instances, there may be no subtests. The items will make up the exam. For example, a written examination on anatomy or embryology or pathology. So the items may not have subtests. It will ultimately become the exam. So there will be items and a complete exam. This is also important to understand. Why am I showing this and giving this slide some more time? Because most of these psychometric indices we will discuss today can be applied at any of these 3 levels. Very easy. So descriptive statistics can be used to evaluate your items, your questions, your subtests, and your exam. It will be the same mean score for the item with the same interpretation we will see later. The same mean or median or standard deviation for a subtest, such as for your medicine 50 questions or for your OSCE station on counseling. And the same mean, median, standard deviation will be used to evaluate the quality, the psychometric quality of your exam. The number of passing and failing students will apply to all. Only reliability and item to total correlations and standard error of measurement will apply to subtests and to exams, because using classical test theory, you cannot analyze reliability for single questions. So you have to have a group of questions to analyze reliability and item to total correlation and hence the standard error of measurement. So you don't see reliability, item to total correlations and standard error of measurement at the item level. The rest are the same. And Cronbach alpha, this is Cronbach alpha, item to total correlations, ITR, and standard error of measurement remain same for exam and subtests. So descriptive statistics, we all know what is a mean score. It is the average score. So you can look at the mean score for a question. You can look at the mean score for a subtest for a station. You can look at the mean score for the complete exam. A higher value of the mean score, for example, 80% mean score on a test or on an item, or a 95% mean score, indicates either that item or that subtest or that exam was easy for the students, or there was a lenient examiner on that question, on that station, or the candidates were very well prepared, because everybody is getting, the average is 80. So most of the students are getting very high scores, or the average is 95. A low mean value, either on a question or on a subtest or a station or on an exam, will represent a difficult question, a difficult exam, or a stringent examiner, or poor teaching and learning by the students. Either it was not taught, it was not learned, it was probably not according to your table of specifications or learning objectives, and hence the students didn't know it. It was very difficult, or the examiner was untrained or very stringent. So you look at the mean score and try and judge the relative difficulty or leniency or stringency of the examiner. Then we come to the median score. A median score is a score above which 50% of your students have scored and below which 50% of the students have scored. For example, the median score is 80%, which means that 50% of your students have scored above 80 and 50% of your students have scored below 80. Suppose your median score is 30%, which again means that 50% of your students, half of your students have scored above 30 and half of your students have scored below 30. So this is also a measure of either ease or difficulty of the item or the exam, or stringency or leniency of the examiner or marking. Same as we discussed for mean scores. Standard deviation. Standard deviation is a measure of the spread of scores. How successfully have you been able to differentiate between your students based on their capability, based on their ability? So suppose the standard deviation is very low. The standard deviation is 5, which means that your students have scored very similarly, and it was an international exam or an entrance level exam. You know very well that students have come from various backgrounds, from diverse systems of education, from different institutions, from different countries, and they cannot perform such similarly. Such small standard deviation, there is a problem. Your exam failed to differentiate. And if we recall, the purpose of the assessment, the purpose of the examination is to differentiate between those who know, who are capable, versus those who do not know or are not capable, who are not ready to be sent to higher level of studies, to be sent from year 1 to year 2 of study, to be promoted or to be graduated or to be certified, or to differentiate between those who will need honors and gold medals and scholarships versus others, or those who should be admitted into a program versus those who are still not ready to be admitted. So the purpose is differentiation. And if your assessment have a very small standard deviation, is not differentiating well enough, there is some problem. For small classroom level tests, where you know that the content was such that you have prepared the students well, they have learned the knowledge and skills well, they are expected to perform similarly, you may expect a small standard deviation in a few of those instances. Otherwise, you will look for the spread of scores, you will look for higher standard deviations. You will also look at the maximum and minimum scores, will also give you an idea on the ease or difficulty of the exam, and also of the stringency and leniency of the examiners. So maximum and minimum scores will also give you some or more idea of the quality of the exams. And the range is maximum and maximum minus minimum. For example, the maximum score was 80%, the minimum score was 30%. So you look at 80% and you now think and analyze, none of the candidates sitting for the exam was able to score more than 80%. What was wrong? What was, if that's a station, was the examiner stringent? Or was the content of that station difficult? Was the question difficult? Was the exam so difficult that students weren't able to do 20% of those one best MCQs? If the mean score on this test was 50% and the standard deviation was 10%, what does it tell you? It tells you And for example, also this was a normal distribution and the mean and the median scores were the same. So as long as the mean and median scores are the same, you can assume it is more likely a normal distribution. For one of the major characteristics of a normal distribution is the same mean and median. So suppose the mean and median is the same. So if the median is 50%, you know 50% of the students have scored above 50%, and half of your students have scored below 50%. That's what the median is telling you. The mean is also 50%. And suppose the standard deviation is 10%. What more interpretation can you make from this? So statistics, rules and principles of statistics tells us if there is a normal distribution, 68% of your candidates will lie above and below one standard deviation. So 50% plus 1 makes a 60% because the standard deviation was 10. 50 plus 10 makes 60. 50 minus 10 makes 40. So you expect 68%, around 70% or 2/3 of your population to lie between 40 and 60% of the scores. Plus minus, exactly, 68% had scores between 40 and 60. Thank you, Sheros. And plus minus 2 standard deviations, which means 50 minus 20 and 50 plus 20, you expect around 95% of the students to be there. So 50 minus 20 is 30, 50 plus 20 is 70. So you expect 95% of your students to be scoring between 30 and 70%. So if the mean and median are close to each other or are same, the data tends to be more normally distributed, and these interpretations will more likely be true. So whenever I do a psychometric analysis, I get some sense as to what proportion of my candidates, how are they scoring? Let us proceed further. Now, there are some tasks for you to interpret. Suppose you are analyzing an exam and you see that there is a low mean. For example, the mean is 35% or 40%. There is a low standard deviation, so everybody is scoring close to each other, which means everybody is scoring lower. The range, of course, is low because there is a low maximum score, low minimum score, and hence the low standard deviation and low mean. And there are very high number of failures. What is your interpretation of this exam? On the chat box, please. I'm waiting for your responses. What are you interpreting? What could be the possible reasons? Low mean score, low standard deviation, low range, high number of failures. Very tough examination. Thank you, Dr. Laikusaman. Difficult exam, yes. Difficult test, I agree. What else? Suppose this is one station. If this is one station on history taking of fever for a final year graduate exam. Teaching learning may be poor. An examiner can be very stringent. Thank you, I was looking for this. So very difficult item or exam, a very stringent examiner, out of the course, not aligned to the table of specification or not well taught or learned. These could be the possible reasons. And when I teach these psychometrics, I always give examples because I believe many of us are doctors as to when we read and evaluate the lab reports. So whenever we read and evaluate lab reports, we know it is also important to consider the patient. You cannot only rely on the lab report. And likewise, for psychometric analysis, you need to have input from your subject expert. So many of us are psychometricians. They may not know the content. We work in departments of examinations, assessments, in medical education, and we do not know all the content. So you need to have content experts with you because they know the patient. They know what was taught. They know what was not taught. If that class was canceled, or if the content is difficult, or there is some content error in the exam, or the item or the exam is not aligned to the table of specification. Or they may know if the examiner was a new one, the examiner didn't come to the training, and so on. So please, whenever you are doing your psychometric analysis, the best practice is not to only look at the lab reports, also look at the patient. Have content experts with you, the exam coordinators, feedback from the examiners, feedback from the students if you have it. Always consult them as well and then make your diagnosis. Second case, a moderate mean score. So an average mean score, a mean score of 60%, low standard deviation, low range, and no failures. Suppose this is a practical exam or a clinical exam, a station, moderate mean, low standard deviation, 60% score, low standard deviation, low range means nobody is getting very high score, nobody is getting very low score, and there are no failures. Yes, thank you, Muniza. One of the conditions can be average difficulty, I agree. Similar characteristics of the examinees and average performance. Very good point, Cheryl. So one has to think, if you expect the examinees to behave, to perform similarly. However, if there was a diverse group of examinees, then there is a question mark. Thank you so much, Dr. Laik. Yes, one of the more common reasons one has to look for is a nervous, not so confident, novice, not so trained examiner, sticking to the midline. Because the examiner is not confident enough, is not experienced enough, is not sure if to give very high or very low scores. Play very safe. Cautious examiner is one of the very important reasons. And I completely agree with all other reasons which have been stated here. So thank you and very good. However, if this was scores from one examiner, please think of a novice, an untrained examiner. A high mean, a mean of 85%, low standard deviation, low range, and no failures. What is the interpretation? Excuse me. High mean, very easy exam. Yes, I agree. Very well taught. Or if this is coming from a single examiner, yes, thank you. Thank you, Mashal. It can be a very lenient examiner or very well prepared candidates. Yes. So suppose the exam mostly consisted of must-to-know knowledge, must-know skills. All students were very well prepared. It was a competency-based exam. You may also consider that everybody knew it well. But for exams with diverse content, easy and difficult items, must know, good to know, nice to know items, this may not be the case. And you expect high standard deviation. And if this is coming from a single examiner, also think if the examiner was very lenient as the standard deviation is low. A moderate mean, so a mean of 65%, for example, or a mean of 70%, high standard deviation, high range, and appropriate number of failures. So let me do the job for you. This is the kind of situation which is desired. So in a well-developed exam, you expect a moderate mean, a high standard deviation, so you have been able to differentiate it between students, discriminate it between students, a balanced exam, good range of scores, and minimal or only those students failing who were really not competent. Thank you. So good quality exam. Yes, I completely agree with you all. Now let us come to the second level of psychometric indices. We talk of reliability now. We discuss descriptive statistics, very easy, very basic. Everybody can do these. Now come to reliability. Reliability is described as the extent to which your measurement, your assessment scores are free of errors. Extent to which measurement is reproducible is a very common definition, and you will find it in all books. So the reliability of an assessment or a score is inverse of error. Higher the reliability, the less the error, the lower the reliability, the higher the error. Cronbach alpha is a very frequently used and reported measure of reliability. It measures one type of reliability, which is known as internal consistency, which means how much correlated the scores of each of the items in an exam are to each other. For very simple, one must understand that that reliability ranges from 0 to 1. So it is in decimal points from 0 to 1. And the aim, the goal, the desire is to have a reliability of 0.8 or higher. For high stakes examinations, the desired reliability, the benchmark should be 0.8. For assessments which have a lot of sources of error, which are very complex, like objective structured clinical examination. Remember, we talked about all sources of error. It has all sources of error. There is an examiner, there is a patient, logistics, if you have all the utensils and gadgets arranged there, the environment, the task itself is complicated, is written as a paragraph. So there are multiple sources of error present in such examinations. And hence, as a benchmark, is for internal consistency is slightly lower. So even 0.7 is considered good. However, for exams which are more standardized, which are more objective, which have lower sources of error, such as one-test multiple choice questions. No examiner bias comes there because it's either an incorrect answer or a correct answer, right? Mostly machines score it. It goes through scanning. And no patient involved. Only the task has to be clear. The key has to be correct. So the marking scheme has to be correct. And the environment has to be conducive. So for such examinations, the desired reliability is 0.8 or even 0.9. And that is why what we say, reliability is somewhat a measure that the variation in score is due to student performance. Remember that slide when we discussed sources of error? We said that the variation in score should only be due to students' performance and capability and competence. It should not go up and low. It should not go high and low. It should not vary due to any other reason. Examiner stringent or lenient, patient behaving differently, environment or whatsoever. So if reliability is higher, it is an indicator that there is a higher chance that the variation is only due to student performance. One catch, one limitation of Cronbach alpha is that value increases with the increase in the number of questions and number of students. So if you keep on increasing the number of questions, or if you keep on increasing the number of students, the reliability will artificially become higher. So in very large scale assessments, when you have tens of thousands of students sitting, what we do just to cross-check reliability, we randomly pick up multiple smaller samples of students and take out the reliability. It has to be as good as of the total sample. If the reliability is going low with when we reduce the number of students, which means that the reliability of the exam was artificially inflated because of a very high number of students. But for class tests with a student count of 100 or 150 or 70, it should not matter. Include all your students and take out the reliability. And number of items. So sometimes you may increase number of similar questions to increase the reliability, but this is the artificial inflation. So you give 10 questions assessing the same concept because you want to artificially inflate the reliability. If the student knows one question, they know 9 all other questions because they are very similar and they are assessing the same concept. And that what leads to the next point. A very high value of Cronbach alpha may indicate redundancy of items. You are assessing the same thing. And hence, Perfect criteria on reference tests may have low reliability. Think of an OSCE station, of an OSCE exam. It have a few stations on history taking, a few stations on examination, a few on counseling, very different skills. A few on respiratory system, a few stations on cardiovascular system, a few stations on nervous system, different skills being tested. So when you are assessing different things, internal consistency, reliability will go down. So whenever in an OSCE exam, you are getting a reliability of 0.65 or 0.7, also consider, don't be too harsh on your exam. Also think if you are assessing very different content, very different skills, and that can be one of the reasons. So when we talked of reliability, it ranges from 0 to 1. So the reliability of the scores on your exam, very poor reliability, 0.87, very good reliability. However, what does it mean? How do I interpret as an examiner, as an exam coordinator, as a faculty, as an assessment lead? How do I use this information? 0.82, what does it mean? So standard error of measurement, and there is a formula which is very commonly available on Google. I'm sorry, I should have mentioned the formula here. Please feel free to Google it. It depends upon the standard deviation and the reliability. So standard error of measurement converts your reliability into a value which has the same unit as of your score. Suppose your scores were in percentages. You have a reliability of 0.8, and you convert that 0.8 into a standard error of measurement. And that comes out to be 4, which means the error in your measurement, the error in your score was 4%. So standard error of measurement helps us to convert the reliability into a value which has the same unit as of your score. Okay, so suppose you had an exam of 200 marks, 201 best MCQs. You have a reliability of 0.74. You are not too happy. There were 1 best MCQs, 200 questions, 150 students sat for the exam, and you were expecting reliability of 0.9 or above. And that is why you are very bothered, because the reliability was 0.74. And hence, you want to now convert it. And now it gives you 16. So 16 is 16 out of 200, which means the standard error of measurement was 8. Because your unit was 200, there were 200 questions. You took the reliability, converted the reliability into standard error of measurement. It came out to be 16, which is 16 out of 200, which means the error was 8%. Let me address a question, and I think we did discuss this. Thank you, Sheroz, again for asking. So Cronbach alpha is not applicable, as I said. So if you are getting lower than expected Cronbach alpha, think if you are assessing different content, multiple dimensions, multiple concepts. Yes. So criteria on reference tests, which will be assessing different dimensions, different content, different skills, may not have a high Cronbach alpha. And if you want to reassure yourself, take the Cronbach alpha of your subtests. So the Cronbach alpha of your subtest should be higher than. This is a cross-check. So as I said, you have 200 MCQs, 50 MCQs on medicine, 50 MCQs on surgery, 50 MCQs on pediatrics, and 50 MCQs on obstetrics and gynecology. So if you take out the reliability of 200 questions, it may come out to be lower. However, if you take out the reliability of your subtest of 50 questions of your medicine, should be better, should be higher, because now there are no multiple dimensions involved. I hope I have responded to the question, Sheroz, and to others. We are running short of time. I'm so sorry, Syed Aswar, we will not be able to use the whiteboard here. Just to be very simple, we know that standard error of measurement is converting your reliability into a value which is interpreted as that of a score. So I think this should be our last slide. Corrected item total correlations. So when we review one best multiple choice MCQs, you must have heard of a term discrimination. And when we analyze OSCEs or other complex exams, you may have heard the term item total correlations. So when we talk of item total correlations, we talk of discriminations. So since I'm not going into the formula and calculations, discrimination for one best MCQs are calculated very differently as item to total correlations. If we calculate item to total correlations for MCQs, it is known as point by serial correlations or point by serials. Don't go into them, because the interpretation is the same. So let us learn what does it mean. So item total correlation, point by serial correlation, or discrimination all mean the same thing. And what does it mean? It means that the question is contributing to the total score. So let us take a step back. Think of your good students, good candidates. So good candidates are expected to perform well on all questions, or relatively better on all questions, or on all stations. And students with lower ability, lower preparation, are expected to perform lower on all or most questions, or on all or most stations or tasks. This is what is expected on a good exam. So suppose there is a question or there is a station on which your good students started to perform lower, and your not so well prepared students have started to perform higher. So your low performing students are performing higher, and your high performing students are performing lower on that one question, or on that one task, or on that one station. It means that the question was not discriminating well. The question had some problems with discrimination, and one has to look for those problems. For MCQs, it can be a wrong key marked, it can be some missing information, typo error, two best choices, two very close options. And for performance examinations, it can be an untrained examiner, an unclear task, your standardized patient behaving differently, giving incorrect answers, or so on. So what is the criteria? Even if the measure of discrimination was calculated using item total correlations, or point by serial correlations, or discrimination, the interpretation is the same. If this value is more than or equal to 0.3, it is very good. It is acceptable. Even between 0.2 and 0.3 is fair enough, not much problem. However, if it goes less than 0.3, look for some causes of error. Are there two correct options? If it goes negative, if it goes less than 0, then there is a possibility of a serious problem. Then you will have to seriously look for problems. Most of it on MCQs is a miskeyed MCQ. The key was marked incorrectly. You correct the key, this discrimination becomes good. It can be an examiner problem. The examiner was not able to differentiate between high scorers or low scorers. It can be your marking scheme, your model answer, your scoring criteria, your rating scale, your items on your tool. So you have to look for problems when the discrimination or item to total correlations or point by serial goes in negative. And I think this brings us to the end If there are any quick questions, Dr. Andaleeb, I'm so sorry we were not able to cover standard setting. I do have 3 slides, but I think we have come to the end of the time. There is a question by Mr. Kareem Rahmani, sir, what is negative reliability? Yes. So in good exams, we do not expect negative reliability. It just means probably you were assessing very different concepts, very different skills, or the examiner, the marking scheme was problematic. The exam may be not according to your table of specifications or your blueprint. So you have to go back and look for reasons, Kareem. Over to you, Dr. Andaleeb. And if there are any further questions, please type it in the chat box.
Yeah, and if there are any questions, you can also unmute if you want to and ask questions because the slides are done. The question from Dr. Moin asking, how do you use standard error of measurement perhaps when setting a cutoff for exam results?
Yes. For standard error of measurements, sometimes very high stake, large scale assessments use it. For example, we use it for MRCGP written assessments and MRCGP OSCE exam as well. So if you have a very high stake exam, because when you're doing these licensure examinations, you are giving license to practice and you are much more concerned for your society, for your body of patients. You don't want to pass your candidates or certify them or give them license to practice because of error in your exam. So what we do is we convert the reliability into a standard error, and we add 1 standard error into a passing mark. So suppose the passing mark was 50%, suppose, and the standard error of measurement come out to be 5%. So we know that there was approximately 5% plus or minus, positive or negative error in all student scores. So there may be a student which may not have any error. There may be students who may have up to 5 marks of positive error, and there may be students who may have up to -5 marks of error in their scores. So a student scoring 65, his or her actual competency may be 70 or maybe 60 because the standard error is of 5, plus minus 5. We don't want to make errors to disadvantage the society. So we add that error into the passing score. So the passing score becomes 55. The passing criteria becomes more stringent and ensuring that no students pass based on the error in the score. So the failure rate goes higher. However, the exam, the license becomes more safe. Your specialists, your general practitioners, if I talk of MRCGP exam or for the MRCS exam, will become more safe to practice. So you add this and you will find at least a few articles explaining this in the literature. For low stakes exam, where you know that the students will go through more exams before they are licensed to practice, you don't want to fail students only because of the error. So you may choose to minus the error from your passing score. However, this is theoretical. I haven't come across any article which says we use this in our institution. So you may choose to do it because you don't want to fail students in low stakes exams because of the error. You may want to promote them to the next level because there are other exams. However, at least I do not know of any practice in any institution for this. However, adding to the pass mark, it is done to make your pass mark more safe, more secure, reducing error in your assessment decisions. I hope I responded to your question, Dr. Moin. Thank you for the question. I missed it just because of time.